Hello guys, and welcome back to AAPC Coding class. Now let's start with CPT Coding Basics, understanding your CPT book. So CPT stands for the Current Procedural Terminology. It was copyrighted and maintained by the American Medical Association, AMA, and these were used with other code set to report healthcare services performed in the United States. This was established as an indexing coding system to standardize terminology amongst physicians and other providers. So the introduction to CPT. These instructions are used for your CPT book. They have unlisted procedures. They have paractical, sorry about that, the notes, accuracy and quality of coding, related guidelines and instructions, and other coding resources. There are three categories to CPT codes, and these include Category 1, Category 2, and 3. There are 5-digit numerical codes 1, 2, 3, 4, 5, over 7,000 service codes, plus titles and modifiers. And they are reviewed and updated annually. So you will always possibly need to have a new CPT book every year because there's always deletions and add-on codes that are added to the book. These are mandated to be report for services and reimbursements. We are always using these CPT codes to report procedures and or visits. The CPT code book is divided in Category 1 in the 6 main sections. Evaluation and management, which you will always see E and M. You will see anesthesiology, surgery, radiology, pathology and laboratory, and also medicines. Section titles have subsections divided by anatomical location, procedure, condition, and or the descriptor subheadings. The subheadings structured by the CPT conventions may list alternative code suggestions in the instructions. Here's an example on page 87. You have the section for surgery, subsection for interventory system, subheader for skin, subcutaneous, and accessory structures, and the categories of debridement. Specific guidelines present at the beginning of each section identified correct code protocol. It's always important to look for those particular cases because it will direct you to the particular code that you're needing to specify in the direction or the decision for the actual surgery, or it will indicate unilateral or bilateral. In this example, on page 245, the section of surgery, subsection of cardiovascular system, starting at code 33016 to 37799. The guidelines indicates the selective vascular catheterization should be coded to include introduction and all lesser order selection catheterizations used in the approach. The description for a selective right middle artery catheterization includes the introduction and the placement of the catheterization of the right column and the internal cardiac arteries. Additional second and or third order catheterization within the same family of the arteries supplied by a single first order artery should be expressed by code 36218 or 36248. Additional first order or higher catheterization in the vascular family supplied by a first order vessel different from a previous selected familiar should be separately coded using the convention description above. Alphanumeric formats with the letter F in the last position, 0001F. This is optional, and it's also performed measure tracking the codes. For example, a physician consults a patient regarding prescribed statin therapy for coronary artery disease. Report 4013F is statin therapy prescribed or currently being taken CAD. The appropriate level office visit code can be from 99202 to 99215. The Category 2 codes have their own modifiers. Due to the constant expanding of identifiable measures for quality patients' care, the AMA lists criteria on their website, which is listed on this link below, and also for the MIPS quality report is on this actual link as well. On page 954, or close, there are temporary codes that are used as well. There are alphabetical numeric structures with the T in the last position. 1, 2, 3, 4, T can be reported alone without an additional category 1 code. Example, 0673T is an ambulation benign thyroid noid percutaneous laser including imaging guidance. This is an example code that will not need a category 1. Category 3 codes, updated twice a year, January 1st and July 1st. They are implemented 6 months after. Any updates and publishing can be listed on the AMA website listed. If a Category 3 code is available, this code must be reported instead of a Category 1 unlisted code. Example on page 917 in your CPT book. The CPT code book has CPT sections guidelines, section table of contents. They have notes that you can make inside your book. Keep in mind, this is your personal book. Personalize it to your way of learning and whatever examples or similarities that you're needing in your book to actually direct you in the actual area you're needing to go. Keep in mind, never ever ever code from your index when looking for codes. Always go into your tabular to confirm your actual code. We also have Category 2 codes, Category 3, the Appendix A through T, and the CPT Index, where you can find all your descriptions for your procedures or services. CPT guidelines are really important. You always want to reference in the introduction of each section and subsection of your CPT code book, if applicable, to the sections being referenced to. Every code does not have a guideline section, so just keep in mind, look for those guidelines in the beginning of your code book so that you're able to refer to them to make sure that you're coding correctly. This defines the information necessary for choosing the correct code. Conventions used throughout the CPT code book and includes the indentions, the sub symbols, and the typical instructions. Sorry about that, guys. I get tongue-tied a little bit. Alrighty, for example, on page 87, we have a breakdown of a debridement. We have code 11000, and it's a debridement of extensive eczema in the infected area up to 10% of the body surface. If you look down, there is a plus sign under the next code, level 11001. This is what's called an add-on code. This particular add-on code cannot be billed without the primary code 11000. If you see, it shows that the description of the 00 is up to 10% of the body surface. If you look at the add-on code, this is for any additional percentage, and it says each additional 10% surface. So keep in mind, you have to use the conjunction with that primary code. And if not, the insurance will deny due to the primary code is not listed. This is only to report additional information that's needed to give the full description of the procedure or services that was provided to the patient. We also have semicolon and the conventionals used in the indentions. This is used as semicolon to divide the description of the code into two parts. Part 1 is the standalone code of the common portion of the procedure code descriptor. Secondly, is the indenting of the description is dependent or to the proceedings standalone code. Now, we have example on page 70 or close, depending on if you're using 24 or 25 coding book. We have the anesthesia codes. 00160 to 00164. You see here the anesthesia for the procedure of nose and accessory sinuses, not otherwise specified. Underneath, it shows the surgery and or biopsy. Interpreted, we have the 00160 to 00164. Please review the actual sections below. Now, we have the conventions on understanding the difference in the add-on code, which I just talked about in the previous slide. Anytime you see the plus sign next to a code, this means that it is an add-on code. You cannot build an add-on code alone. You must have a primary code build first before you can do any add-on codes. Let's look at our example. We have the code 11200 for removal of skin tag, multiple tags, any area up to 15 lesions. So with this particular code, you only can use this primary code if you have 15 lesions that's being removed. Now, say for instance, if there is 20 lesions on this particular patient that needs to be removed, we're going to use the particular add-on code with the primary code. We're going to build both 11200 and 11201. If you look at the 11201, it actually shows each additional 10 lesions are part thereof in addition to the code of the primary procedure. So if there is 20 lesions, we're going to build both to indicate up to 20 lesions that were actually removed in a session and or visit. Now, we're looking at different things that are in your CPT book that you want to actually pay attention to, and these particular symbols are important. You have a red circle that indicates a new procedure code has come into effect. This is only in your 2024 CPT code books. This particular code has already been added into 2025. So you won't see this actual red dot on this particular code 15011. It's already been changed and it's a new code already in the 2025. Now, if you had a 2024 book, it will show up in there as a new code. We also want to look at the blue triangle. This means that there has been a code revision, meaning there has been a change or a correction within that code. If you have a reference to a 2024, you will show there was a revision with this actual triangle here for the code 92132. It says computerized diagnostic imaging, and this is for an anterior segment with interpretation and report, unilateral or bilateral. Okay, so in the book, you can look in your book and see there are other codes that show the triangle or the red dot, which indicates either a revision or a new code has been entered. Next, we have the two face triangles indicate new and revised text other than the procedure described. You can see the example on page 778, which is actually referred to as the 2024. On 778, it might be in between those particular book numbers, but might not be that actual page number, but it does show go to the code 92242. And this is an angiogram of an endocranium. Green endocranium includes multiple frame images performed at the same patient's encounter with interpretation report. This can be done unilateral or bilateral. So anytime you see these particular, the two face triangles, that means that there has been a new revised text to the description of the code. Please pay attention to those symbols because it's very important to make sure that you have the correct segment of the portion reviewed so you can choose the correct code. Next, you have the circle with the line through it. This means exempt from the use of modifier 51. Now, modifier 51 means multiple procedures. If you see this particular symbol by this code, that means it cannot be used as a multiple procedure with this modifier 51. Okay, so you can refer to on page 144 or in that percentage of the 144, and you can look at the actual code 20974. Next is the lightning bolt symbol. This means that the codes for vaccines that are pending FDA approval. That means that they have not been approved by FDA yet. We also can see the example on page 761 or close or before it. If it's a 2024 book, it will have that listed. In 25, it might not have the lightning bolt because it's already in existence. But you can look at code 90668 is the actual the code that has not been FDA approved. I think it is as of now. You can check out our AMA website, which is the American Medical Association. The website is listed below. Next, the number symbol. It means resequence out of numeric order. Sometimes you will have some codes that will not be in the numeric order that you're looking for. It could be either in a different section or another area for you to review. But your coding book will definitely direct you in the correct area to look for the correct code. If you look on page 388, this is only referring to in a 2024 book. In 25, it has already been updated. You see it's for code 46947. Next is the STAR identifies CPT codes using telemedicine with the actual modifier 95. This is only for, this modifier can only be used on services that is done by video audio visit. Meaning, just how we're doing now with the video and you can hear my voice, la 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 la, this is the time that you would use a 95 modifier, meaning that the actual visit was done video audio conference. Now, it'll be different if it was just done by audio, which is over the phone, without a video, then that's something else we will talk about a little bit later. But in this particular case, we're looking at the example from this particular example is in 2024 book, and it shows that it is for page 767, and we're looking at psychotherapy 30 minutes with the actual patient. It shows a star there, meaning that we can do this actual code visit according to video audio conference. So 90832, it shows audio icon as well. Identify the code for telemedicine services that uses audio only communication, and we can report 93 modifier only from the actual audio only. So keep in mind, 95 is for video audio, 93 is for audio only, but they both can be used on this particular code. Keep that in mind. Next, CPT Code Basics. Review medical documentation thoroughly and gather additional reports. Reference the alphabetical index for the CPT numeric code and or code range. We're always going to look at the condition, procedure or services, anatomical area, and we're going to look for abbreviations. Keep in mind, look for your main terms and keywords that will help direct you into the correct area to look for these particular codes. It's always important to always review your documentation fully so that you'll be able to find the full description of your codes in your book. Also, keep in mind, you might not be looking for your actual descriptions according to what's in the documentation. And let me tell you how. Blood can mean hematoma. That's what I'm meaning. You might not necessarily be looking up, example, if it's blood in the belly, you might be looking at a hematoma in the belly. Just FYI. Always review your numeric codes and code range for specific descriptions. Follow CPT guidelines, conventions. It's very important. If you miss your guidelines, you can miss a very important vital step in your code search. Keep that in mind. Your index. Your index starts at page 1260. Now keep in mind, this is only for 2024. In 2025, I think it's another page, but I don't remember the page specifically. But your index is in the back of your book for your CPT books. It's in the front of your book for your ICD-10. Keep that in mind. Diagnosis is ICD-10. CPT is procedures and or visits. In this particular example, it shows biopsy, ovary biopsy, which takes you to code 49321 or 58900. In the numeric section, you go to surgery. Subsection is female genital system, which starts at 56405 to 58999. Subheader is ovaries. Category excision. 58900 is for a biopsy of ovaries, unilateral or biopsy, separate procedure. If this is done laparoscopic, biopsy and ovaries of fallopian tubes, it's indicate to use code 49321. Now, in the case if we're using this actual code section, always make sure is keep in mind your convention and guidelines when coding. Example, separate procedures. Looking on page 455, we have a procedure that's 58900 for a biopsy of the ovaries, unilateral or bilateral. Separate procedure. You also have 59820 for a rib wedge resection or bisection of ovaries, unilateral or bilateral. National Coding Correct Coding Initiative, NCCI, is really important. This is for basically when there are codes that cannot be billed together and in reference to they are inappropriate reimbursement with the insurance. This was implemented by the CMS and that controls the improper assignment of codes that result in inappropriate reimbursement. This is called procedure to procedure edits. We can always review this on the CMS guidelines for the NCCs on the website listed below. Here is a breakdown of those actual codes and when there are deletion and add-ons, effective and non-effective, when we can use modifiers, when they are allowed and not allowed, and if they can use separate procedures or not. Please review each column carefully as you review this section. Based on the RBRVS, this is physician work, practice expenses, professional liability, and malpractice insurance. If you want to do review for that, here is the link listed below. Articles answering everyday coding questions, CCI bundle information, E&M billing guidance, current code use and interpretation, case studies, demonstration, practical applications of codes, anatomical illustration charts, graphs for quick reference, information for appealing insurance denials, information to validate codes usage when audited. We always can use the CPT assistance. It is also listed in your CPT book as well. Appendix, CPT Appendix. Appendix A is in CPT book 2024 on page 985. Also, the modifiers are categorized as modifiers applicable to CPT codes, anesthesia physical status modifiers, CPT Level I modifiers approved by ambulatory surgery centers, hospitals, and outpatient use, and HCPCS Level II modifiers are all in the appendix in the back of your CPT book. Appendix B, these are changes and additions to the CPT codes for the previous year. Appendix C is on page 1003, and Appendix D are add-on codes, which are in the back of the book as well on page 1003. Appendix E is the except for the use of modifier 51. Keep in mind that is the circle with the line through it. And we have Appendix F for the exception for the use of modifier 63, procedures performed on infant less than 4 kilograms. Appendix G is a summary of CPT codes that include moderate conscious sedation, removal of deletions of the moderate sedation symbol, and this reference guides is for codes 99151 through 53 and 99155 to 99157. Appendix H is for the alphabetical index of the performance of measures by the clinical condition or topic. You can also review this information available on the AMA website. And Appendix I is for genetic testing codes modifiers. Also for approved with deletions of the molecular pathology stacking codes. Appendix J is for the electrodiagnostic medicine listings of sensors and the motor and mixed nerves. It assigns each sensor, motor, and mixed nerve with its appropriate nerve conduction study and table containing maximum number of studies. Appendix K is for products pending FDA approval. This identifies throughout the CPT code book with the lightning bolt symbol. For update vaccines that are approved by the FDA, you can visit the website listed in the presentation. Appendix L, vascular family. This is based on the assumption that a vascular catheterization has a starting point of the arterial and with the pulmonary artery and portal vein. Illustrates vascular families that urge from the arteria using brackets to identify the aorta vessels. Appendix M is read-numbered CPT codes crosswalk. This crosswalk is part of the CPT assistance reference for deleted codes, and essentially when referencing citations regarding codings for specific procedures. Appendix N is for a summary of resubsequent CPT codes. Appendix O is for the multiple analyte assessed with the analyst. Appendix P is for the CPT codes that may be used for telemedicines. This is the one where we're going to be using the modifier 95 for the virtual audio visits. Appendix Q, severe acute respiratory syndrome and the coronary virus 2, coronavirus 19 vaccines, and this contains a table to link the individual COVID-19 vaccines products codes to their associate immunization administrative codes. This includes vaccines manufacturers, vaccine names, the NDC numbers, dosages, and the removed CPT codes that are no longer used for that. In Appendix R is for the digital medicine services taxonomy. Taxonomy and definitions for services that can be provided as digital medicine. It will have all of those details in that particular appendix. Appendix X is for the artificial intelligence taxonomy for medical services and procedures. And Appendix T is for CPT codes that may be used for real-time interactive audio-only telemedicine services. This is that 93 modifier that can be used for only audio use if the virtual video is not working and we're using a phone for the actual visit and or consultation. Next, CPT Global Surgical Package. This includes a standard package of preoperative and interoperative and postoperative services. Payer policies may vary, may be furnished in any service location. For example, a hospital, an ambulatory surgical center, and also in a physician's office. Now, what are the guidelines in reference for a global surgical package? This includes surgical package and not separately billable. This is for a local block or a digital block of a topical anesthesia. Evaluation and management services subsequent to a decision for surgery on the day or before or a day of surgery, including history and physical. Immediate post-operative care, including dictations, operative notes, talking with the family and other physicians and other qualified healthcare professionals. Writing orders, evaluating the patient in the post-anesthesia recovery area, and typically postoperative follow-up. Major surgeries have a postoperative period of day 1 with 90 days for the postoperative period. Minor procedures, the postoperative period is the day of the procedure with a postoperative period of either 0 or 10 days depending on the procedure. Now keep in mind, anytime there's a major surgery, you're going to have this postoperative period of 90 days, meaning that anything that is relating to your particular surgery that you had is already paid for by the insurance. We can no longer bill for those particular surgery or anything that's going on relating to that procedure unless it's unrelated. If it is unrelated, at this point, it is not part of the global surgical package. This is a new problem that we need to bill for. This also can happen in the minor procedures within your 10-day global. Anything that is related to that procedure that has a 10-day global cannot be additionally billed to the insurance, such as pain, swelling, redness, medication refills, or other issues that's dealing with that particular procedure. But if it is a new issue, it's no longer part of the global surgical package, and then we can then bill it to the insurance. Keep that in mind. CMS global surgical package. Here is the global periods for a lot of the actual procedures. Keep this in mind when you are scheduling a patient for a new upcoming problem. If it's within the postoperative period, we need to make sure that it's not related or related so that we can know how to bill the actual claim, or if we are able to. So we see here a couple of examples for the actual procedure code of 26010. It says drainage of finger abscess, which indicates 10 global days. So anything related to that abscess of your finger, meaning that if it's red, if it has pain, if it has fever, warmth to the touch, this is something that is related. So anything, if it's in that 10 days, then we cannot bill the insurance. But if it's a new problem, meaning that, say for instance, if you have flu symptoms, sore throat, runny nose, or something like that, within that global period, you then can bill for this particular issue because it's unrelated to your finger abscess. Looking at code 26034, treat hand bone lesion. As you see, it has a 90-day global, which is a little bit different from the 10-day global. Anything related to that particular treatment of the hand bone lesion, we cannot bill additionally to the insurance because it's already been paid for in the global package, meaning that they won't pay anymore. So anything unrelated, they will pay for within the global period. But if it's related, they will not. Always keep that in mind. CMS Global Surgical Package Continuation, MMM or XXX. Global consent does not apply. Why? Subject to individual pricing, and ZZ always included in the actual global package. You can possibly see these particular things on the CMS guidelines for the global periods for Medicare patients. It's also the same for commercial patients as well. Global package modifiers. We have the 54 modifier for surgical only, 55 for post-operative management only, and 56 for post-operative management only. Pre-operative, I'm sorry. You have the 26010 for the drainage of the finger, which is the 10, and anything that is, like I said, within that global, we don't bill. If it's unrelated, we can. The same for the decompressed hand tendon shaft, has a 90-day global period, and we can use these particular modifiers as well. All right, global package modifiers. Let's continue. We have, for example, we have the 24 modifier, meaning unrelated to E&M by the same physician and or other qualified healthcare professional during a postoperative period. So, example, January 22, patient is seen for an injury to the right index finger. The patient's finger is amputated at the DIP joint. March 15th, patient is seen by the same physician for a right leg infection. Because the March 15th visit was unrelated to the finger amputation surgery, we're going to add the modifier 24 is appended to the evaluation management services, meaning because it's unrelated in the postoperative period of the finger amputation. Hope this is clear. Next, 25 modifier means a significant, separate, identifiable evaluation management service by the same physician and or other qualified healthcare professional on the same day of the procedure or other services. Keep in mind, minor procedures have 0 to 10 global period. Here is the example. A patient visits the family doctor for chest pain. The provider performs a complete workup of the chest pain and also removes a lesion on the patient's arm. The procedure of removal of the lesion is separate, identifiable from the office visit. Okay? So, anytime you bill any other services with an evaluation and management, always append that 25 modifier. This indicates that this is a significant, separately identifiable visit that was done on the same day as a procedure. So we're going to add that 25 modifier to our E&M code, which is the visit code, which will give separate reimbursement to 2 of the services that was done on one day. 57 is for decision of surgery. Keep in mind, 57 modifier is only used in an inpatient or hospital setting. This is the same just like using a 25 modifier in an office setting, but it's not used in an office setting ever. It's only used when an inpatient or hospital visit is done and a decision for surgery is on either the same day or the next following day. Let's look at the example. A patient visits the emergency department with an acute right lower quad abdominal pain that increased with cough and motion. The provider determines the patient has acute appendicitis and decides to immediately perform an appendectomy. So the actual emergency department code was a 99284, using the 57 modifier for the decision for the appendectomy, and that code is 44950. The decision for surgery was made during that visit, and that falls within the pre-operative global period that a 57 modifier would need to be added to the E&M code for the emergency department visit. 58. Stage or related procedure or services by the same physician and or qualified healthcare professional during the postoperative period. 78 modifier means unplanned return to the operating or procedure room by the same physician or other qualifying healthcare professional following the initial procedure for a related procedure during the postoperative period. 79 modifier is used for unrelated procedure or services by the same physician and or qualified healthcare professional during the postoperative period. 58 modifier, stage related procedure or same by the same physician or other qualified during postoperative period. Here's example. March 22nd, had a breast biopsy. March 6th, modified radio mastectomy. We're going to add the 58 modifier to the ratio mastectomy. Why? There was a biopsy that was done within the global period. When the mastectomy was done, we have to indicate, because the mastectomy was done possibly by confirmation of cancer in the breast or possible cancer in the breast. So the mastectomy was done within the global period of the biopsy. So because it was related to the breast biopsy, the reason of the mastectomy, it's related. So we're going to add that 58 modifier to the actual mastectomy because of the breast biopsy. Hope you're getting this. 78 modifier example. This states that it was an unplanned return to the operating room by the same provider or qualified professional. So, example, it shows in January a gastric bypass with a 90-day global period was done in January. In March, they came back and done an incisional hernia on the bypass incision, taking back to the operating room for the incisional hernia repair. it's going to be a 78 modifier that's added to the hernia repair because it was an unplanned return to the operating room. Okay. 79 modifier example. This states that it's unrelated procedure or services within the same physician and or qualified professional. January, amputation of finger. March, below the knee amputation. It is not related. One is finger, one is knee. It's unrelated procedures. So we're going to add the 79 modifier because why? The amputation of the finger has a 90-day global period. It's done in March. That's not done of that's not done of the actual global period. So what we're going to do is we're going to add that 79 to the knee amputation because it's unrelated to the finger that was done within that global period. Hope it's clear. Surgical modifiers. 22, increased procedure services. 22 is used anytime that a procedure, for example, it was normally takes about 20 minutes to do the procedure and it took the actual provider 40 minutes to do. We're going to add that actual 22 modifier to the code of the procedure that was done if it's over the increased procedural time that it would normally take to be done. 50 modifier. Always mean left and right side is done. If it is just a left side or just a right side, for a left side, we're going to use the LT modifier for left side, RT for right side. 51 modifier, that's always when multiple procedures are done. We're going to use that modifier on the second least minor procedure of the actual procedure if there's one or more done. 22 is reduced services. In the case if it wasn't done all the way completed, not saying that you discontinued it for any reason, but if it didn't take as much time or something had to be stopped in between, we're going to use the 52 modifier. Not saying that we're not going to bill for those services, it's just that we're going to get probably a reduced reimbursement for it because it wasn't completed all the way. 53 modifier is discontinued procedure. That means that anesthesia was done, they have opened the person up and they have gotten started and possibly the person started to code. Blood pressure dropped. This is possibly a life or death situation to where the provider had to stop the procedure due to the fact of the well-being of the patient. So we're still going to bill it to the insurance company, but we're going to add that 53 modifier indicating that we had to discontinue it for any reason. Documentation always need to indicate that. Whatever you're coding, the documentation must match. 22 modifier. This is an example. This is for a patient had a colposcopy and a polyp is removed. The removal of the polyp caused excessive bleeding and in extra 30 minutes is spent controlling the bleeding. Modifier 22 is then added to the surgical code and the operative report and or letter must be sent to the claim for the payer to explain the need for the 22 modifier. Example was the polyp removal. It took an additional 30 minutes. So like I said, anytime additional time is done that is out of the normal for the procedure, we add 22 modifier. Bilateral. Check the payer on how to submit. Line 1 could be a 50 modifier, for example, and we're going to use that particular code. Line 2 with the modifier 50 on the second one. Okay, or the actual insurance could want RT and LT, but always find out with your payer what they want so that you can bill it correctly the first time. Some take it with the 50 modifier in one code, some want just a primary code and then the secondary as a 50 modifier, and some is they want the RT or LT to indicate bilateral. Always check. Please code attention to the code descriptions. Sorry about that. Some codes specify unilateral and include parentheses statements. Example, code 50592, ablation one or more renal tumor, unilateral. Some codes say one or both. Okay. So 58900 is a biopsy of the ovaries. It states unilateral or biopsy, separate procedure. So in this particular case, it tells you that this can be done unilateral or biopsy. Doesn't necessarily need a modifier in this particular case because it states it in the description. So as long as it states it in the description, modifiers are not needed. More than one procedure performed at the same session by the same provider. Not used on E&M, which is evaluation and management, physical medicine, or rehabilitation services. The provision of supplies such as vaccines or code design designated as add-on codes. Example, under general anesthesia, an orthopedic surgeon performs a closed treatment of a femoral shaft fraction on the left leg and closed treatment of the right knee dislocated during the same operative. So we're going to use LT indicating the left leg, and we're going to use 27552 indicating that 51 modifier for multiple procedures and indicate the RT for the right knee dislocation. 52 modifier. This is a procedure partially reduced at provider's discretion. Service is not completed in its entirety. Example, code 43770, laparoscopic surgical gastro-restrictive procedure, placement of adjustable gastric restrictive device. For individuals component placement, we're going to report 43777 with the modifier 52. Procedure terminated due to, and this is when we're using the 53 modifier, circumstances are threatening the well-being of the patient, as I indicated. Do not use if the elective cancellation is prior to the induction of anesthesia. So that doesn't necessarily mean discontinue. That just means that it was canceled. So we're not going to bill it unless the actual procedure went forth and there was a life-threatening issue that caused us to actually stop the procedure. Example, a patient who is having a surgical procedure and after the administration of general anesthesia is unstable vital signs. At the recommendation of the anesthesiologist, the surgeon decides to terminate the procedure. This is the case where the 53 modifier was used, meaning there's a life-threatening issue for the patient and we had to stop it. So we're going to build the code and we're going to add the modifier 53, indicates discontinue services. 59 modifier is always sometimes used very willy-nilly and also is not used properly sometimes. This is for a distinct procedural services, okay? Meaning procedures not normally reported together, different sections or patient encounter, different procedures or surgeries, different sites or organ systems, separate incision or excision, separate lesion or separate injury. This is the only time 59 modifiers are used. Make sure that you're using it properly because it can cause a denial to your claim with the insurance. CMS provides a subset of 59 modifier. They have XL for separate encounter, XS for separate structure, XP for separate practitioner, and XU for unusual non-overlapping services. Be careful when using these particular modifiers. Make sure that you look at the descriptions of the modifiers to make sure that you're using them properly when coding for accuracy. Example, a patient had a coloscopy and a lesion is removed proximal to the sphincter flexor. During the same colonoscopy, a biopsy is taken of a different lesion. Both codes are reported using modifier 59 on the second procedure. Because why? The coloscope is primary to the lesion removal. So the lesion removal is more of a minor procedure. So we're going to use that 59 modifier on that one. 63. Procedures performed on an infant less than 4 kilograms. Increase work intensity. The temperature controlled, obtaining IV access, maintenance, or hemostasis. Read the note in the description to make sure you're using the modifiers correctly. Note that some procedures, such as 31520, include a note in the CPT. Do not report modifier 63 in conjunction with this particular code. See your Appendix F in the CPT for a list of codes exempt from using your 63 modifier. Always reflect to your guidelines and conventions because it will help you make sure that you're doing the accuracy of billing. 76 modifier, repeat procedural or services by the same physician or qualified professional. Example, a patient who goes to the emergency room for trauma to the chest, a 2-view chest x-ray is taken, then shown for pneumothorax. After a chest tube is placed, a repeat 2-vision x-ray is taken to verify the placement of the chest tube. Because they had to go back in for the original to see what the actual what was showing inside the patient's chest for the trauma, there was a tube that was placed inside of the chest, so they had to go back and do a second x-ray to see about the placement. So because it was return or repeat procedure, we're going to bill it twice. The second one we're going to append with the 76 modifier indicating repeat procedure. 77, repeat procedure or same by another physician. Same aspects, but it's done by a different person. Example, it says a patient who's seen the family practitioner for chest pain and the physician did an EKG and then refers the patient to a cardiologist. The patient sees the cardiologist on the same day and the cardiologist performs a repeat EKG. The second EKG is reported with a 77 modifier because why? It's a repeat procedure, but it's done by another physician, not the same. 72 modifier for 2 surgeons work together as a primary surgeon, perform distinct parts of a procedure, dictate op report of their distinct part. Each will submit the same code and append with a 62 modifier. That indicates 2 surgeries. 66 modifier is for a surgical team. Highly complex procedures require differently specialties, and the modifier 66 is to append the procedures coded by each surgical team. 80 modifier is for assistant surgeon, 81 for a minimum assistant surgeon, 82 for assistant surgeon when qualified resident surgeons are not available. Ancillary modifiers, global, a procedure containing both a technical and professional component. 26 modifiers per professional component, and TC is for technical. Example, a patient comes to the office with wheezing and congestion. The physician takes a 2-view chest x-ray using his or her own equipment and sends it out to be read by a radiologist. The office reports a 71046 technical component, TC modifier for the use of the equipment. Okay. The radiologist reports the 26 modifier for the interpretation and the report for the professional services. If the physician performed the x-ray in the office and performed the interpretation on the report of the code, the 71046 without any modifiers to indicate the global services, both the technical and professional component. 90 modifier is for reference for outside laboratory, 91 for repeat clinical diagnostic lab tests, and 92 for alternative lab platform testing. 23 modifier is for unusual anesthesia, 47 for anesthesia by the surgeon, and it must report a physical status modifier anytime anesthesia is billed. Meaning if the patient is healthy, not so healthy, life-threatening, those particular P modifiers must be added additionally. And that concludes our actual course for today. Thank you.